Oh, yay. Oh, awesome.
Because he wants to be Legia tonight.
Yes, I get to do it. And then wear two. Wear a green boy's hat and.
I'm not going to say anything about a big head. Okay, so we'll call this meeting to order. If everyone would like to stand with me, we'll do the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. With that, do we have people on the line? Yes, we do. Okay, so what we'll do is we'll go around the room and introduce ourselves, and then we'll get the people online to introduce themselves when we're done. Okay, I'm Lisa Gorley. I'm chair of the Community Health Committee. Brandon?
I'm Brandon Nish, I'm the finance director.
Committee member.
John Morgan, Sweet Home Police Department.
Thank you. YAC. It's easier. Okay. Thank you.
Bob Dalton, Health Committee member.
Thank you. Okay, Mr. Knowles. You're on mute. Oh, no.
We can see you.
Okay.
We can't hear you.
All right. Thank you. So this is Dick Knowles, everybody. Blair.
Blair Larson, Community and Economic Development Director, City of Sweet Home.
Thank you. Shirley.
Shirley Bird, Executive Director of FAC.
And Brock Byers, Program Manager for FAC.
Thank you. Glad to see you both here. Thank you, everybody, for being here. So with that, we have the minutes. And on the minutes, I noticed it said the chair talked about the 80 plywood Christmas cards. I believe that Jim did that. So with that change,
As amended.
as amended, is there any other changes? Everybody have time to look at them?
As amended.
Okay. Do we have a second?
I'll second that.
We have a motion and a second. Any discussion? Okay, all those in favor?
Aye.
Any opposed? All right, thank you. Motion passes. So that brings us to committee reports. Oh, yeah, that was the minutes. Okay, down here. So do we have anything from our healthcare people?
What I've been working on, and I know Dick Knowles has kind of been involved with this some, but again, we're still following up with the medical bus that we did have here previously. And then also just to kind of give you an update, because I do sit on the subcommittee for Samaritan Health fundraising for the new clinic. And I am proud to announce that even though we have a goal of $1 million plus and going towards a $9 million project, we're sitting at 955,000 as today. So job well done by those who are making a difference.
That's very exciting. Any questions, discussion? Okay. All right. So you're thinking about having the medical bus come back?
Yes, the medical bus was being utilized for vaccinations through the COVID, and they're seeing a little bit of ease up on that, so it may become available to us here in our own community. So we'll be looking at when. I've got an email. I'm waiting to hear back when that could happen, possibly. I'm looking maybe more into maybe the first of the year sometime. And then also maybe taking a look at the kinds of services that medical bus is being utilized for, and maybe locations. I know we used it last year at the Methodist Church, trying to tie that in with MANA because that seemed to be the population that we wanted to target. But there was a real reluctance of individuals to step through that bus door. So as much as you can put it out there, sometimes it's like you're pushing, the cart uphill. So maybe look at our strategies, how we can look at that differently and roll it out differently and encourage people to, take advantage of having that type of a service mobile. Maybe at the high school parking lot, that might be a good location for that, depending on what the services are available. I know last year we tried to tie in the mental health side of it some, which was kind of a hit and miss. We was trying to work with the school district at that time for kids that were, under stress and adults from the COVID crisis. But there may be some opportunities. I think as a health committee, we have an opportunity, I think, to identify some specific topics maybe in our community and not get too far down different rabbit holes of projects that we're currently doing that takes away our focus. And I'll give you a good example. When I think of the medical bus, this last week, I got a call from my dermatologist letting me know that I had a melanoma skin cancer. And it was a call I didn't expect, but it sure scared the bejeebers and still does out of me because I can't really go see a doctor until the end of the month. And you're like, okay, I want this guy out. I want it out of here. But I think when it comes to a medical bus, is it possible to use that as a method or mechanism for scan checks, for people that may go undetected? Because I know during our health fair, we actually had one person when we did get that had skin cancer that didn't even know they had it. So I think, there's some opportunities out there to maybe utilize some sort of a mobile service like that to
So
bring more awareness in our community.
have you thought about the parking lot at the end of the high school football field?
I think we're looking at everything in that, Jim. I don't think there's no one location that may be ideal. I've thought about Weimar Police Station parking lot area because there is a lot of traffic comes through there. Maybe how you put the sandwich board out front, what you're actually promoting, and getting people to have a conversation of what those services are and how they can access them. Because I think a lot of times people look at those services as it's going to cost me some money. And I don't have a lot of money, when a lot of times these services are being provided at no cost. So I think we have an opportunity to build upon what we started.
Do they use like little business cards or something that they put out at different places that might have some facts or something on it so people would know, at least be able to call and ask questions about it, or what days?
The last year that we used it, we put out a lot of flyers with information like that and phone numbers. It was in the newspaper, and the New Era did a really good job of, advocating the medical bus and other health services. But again, you can put out flyers and you can put out banners. And I know Dick and I put out a tremendous amount of signs last year for mental health. And again, it doesn't necessarily ensure that people are going to take advantage of that. So I think that's an ongoing challenge that they're in this type of volunteer service in a community and committees. It's a challenge for us because we offered a lot of health services at the health fair, and people were good at picking up the freebies, but not really engaging the conversation as much because, we had everything. Samaritan had 7 or 8 tables. We had mental health groups there. And again, certain things trigger people just to walk on by, especially the mental health tables. They see it. So, they don't want to engage in that. So it's a challenge for us, but I do think there is opportunities out there for us to build on that.
I was just wondering, because we had identified before that people were going to the fire department and having their blood pressure checked and different things because it was free.
Mhm.
And so I was wondering if the bus was positioned across the street there in the old economy drug parking lot. If you have a sandwich board or even little business cards or something on the front door of the fire department to say, if it's non-emergency, have you thought about going to the
And
the
it
bus?
it could actually be moved in different locations. It could be there one week and it could be there the next week, but getting it where people are feeling comfortable to access it and walk up those steps and through that door. That's the challenge. It's no different than having a homeless population that you got services for and you can't lead them to that trough necessarily, of
Yeah.
water. So makes it a challenge.
Well, thank you. Any other questions, anyone?
I could just
Okay.
add something to that, Bob. I know that in the past, American had talked about certain areas of the community that were utilizing a lot of their resources,
Mhm.
and it was really kind of confined to a certain block area or a few certain blocks. But they considered outreach to that areas that utilize American service a lot and promote this aspect of, you know, the medical bus will be here at the station, and really try to get ahead of it, because it's just showing up. It's gonna be a long haul before people are comfortable. And
Exactly.
and it's gonna be, and it's not gonna be just after a couple of months, people are flowing through it. I think that's gonna be a long process before.
I,
before actually confident in that.
I know a lot of cities I've researched on do have such services like an outreach, where they walk out among, introduce yourself, how can I help you, and get that conversation and that trust built. And that's what you're referring to, and get a trust built among someone that they feel comfortable with. Yep.
So Western University, that's one of the things that they talked about. Remember, Bob? They talked about that, that reach out, and that where the groups of people may need more help in certain areas, they might have,
That was probably 4 years ago.
yeah, but they might have some of that information, or be able to get some of that information, and maybe as part of their, some of their stuff, they might be able to do some of that outreach. I wonder if that's a good idea.
And I think that's something you could look at medical students.
That's what I'm saying,
Internships
that
that
Western
are wanting
University.
to come out and establish it. I think those are the kind of conversations I think this committee could really have with the Samaritans of the world, or any other clinic, you know, to come in. These are the things we're wanting to do. How can you see that happening? I think even with the new clinic, I've really brainstormed that, you know, we're going to be fortunate to have this facility come to our community. And I think at some point, I hope and pray that we can have that conversation with the Samaritans is, you know, even though there'll be that basic medical care you'll probably provide, but what about some of these others? You know, just like I said for myself, going to a dermatologist and finding out you got an issue that you're good at watching yourself, but maybe not quite good enough. Is it something one day a week that they could have at their facility to maximize on things like that, or the mental health? If they can't hire full time 24/7, can somebody be there once a month or twice a month with these types of services that we may want to target later on? I think those are the kind of conversations we are capable of having.
Well, I think if they did advertise on this date, we're going to be looking at skin cancer screenings, right? That all you have to do is sign up. I think if they think that that's what they're doing, that they might be more likely to show up for that day. Or if we're doing diabetes screenings or whatever it is, that if you target specific things that are a higher interest, blood pressure screenings and counseling, that kind of thing, that maybe you could get some greater response
Yeah.
from people who
I
worry
agree.
about those
I think
things.
it's how we approach it and what are the resources and how we just connect those dots. But I think
Okay.
that's an opportunity for us.
So, and I see um, Dr. Horton is at Disneyland with grandchildren. I don't know why, but anyway, so we have nobody here from Western University today, if that's all right.
I left a message with him today to see if he had anything that he wanted to bring up.
Did he?
And no, he said Mickey was great.
Okay,
You
fine.
couldn't report live from the teacups. This is Larry Horton. And
Might have to have his Mickey's ears checked to find out why they're so large. All right, so that takes us to the Homeless Action Committee. Brock, would you like to report on that with us?
Absolutely. Good evening, everybody. And sorry we're not there in person, but we were participating in a grant meeting that's coming up called the 110 measure or 110 initiative. And so we were learning about the RFP for that. Boy, there's a lot going on, and I'm sure Blair and Ray may have some other updates. So what I'll initially do is just at least give some updates from FAC perspective and such. I'm going to go through some of the lower level items. So things like volunteers and employees. So we have put the word out. We are looking to hire between 2 and 3 people here, between now and December 1 or near our release date. We've gotten what, 5, 6, 3 applications, formal applications, and some more interest. It is at least right now at minimum wage, and we're just kind of feeling that out. So we'll be doing some interviewing next week. The resumes we've gotten are quite impressive, actually, from the community there. So that's good to hear. As far as equipment, we've been acquiring equipment. So things like we acquired dog kennels, hand sanitizing stations. And so these are the stand-up sanitizers. We picked up a bunch of those this last week, and we did order the overall event tents, the 20 by 40 tents, which will be arriving at the Public Works area since they're about 600 pounds a piece. Those are arriving on Thursday. Let's see. We'll be producing a newsletter and an overall kind of program update by the end of the week, because we need to notify all our partners and as well as just working with our volunteers. We'll be having staff and volunteer meetings this week to get everybody apprised of the latest that's kind of going on. Let's see here. As far as what I at least know as of today, and perhaps Ray and Blair know a little bit more, there was a little bit of a snag with the property. And I was given a phone call this afternoon, and basically it looks like the property that we were hoping to get all settled and done with at the end of this week looks like it may take about a 2-month delay, because it's going to have to go through procedure. And basically the county commissioners were meeting with their lawyer today. And there's a different frame for which they are presenting to Blair and Ray. And I don't have the latest, but from my perspective, it looks like the final site may be delayed a few months. So I'm assuming kind of back to plan A or B that we had before, which is utilization of the public works space that we were looking at as a temporary space, and then transitioning over to the permanent space as we get it conditioned and get it set up and get the public hearings and everything kind of done with that. On the grant front, as I mentioned, we were meeting with the 110 initiative, which is that comes from, is it not the marijuana? It is from the marijuana action group. And there's a fairly large or substantial sum of money that's available to the groups there. And so we were learning about what the application process, the due date for that application is December 9th. I've talked with our grant writers that are being provided to us from the county, and we'll be meeting tomorrow, I guess, or at least we're reconvening. They're going to go through those and other grants. But there's a fairly substantial amount of money. They also mentioned that there's another grant that's going to be presented soon that will have about $110 million. And I don't, what's the dollar amount for this one? This was
31 million.
31. And then CSC, I believe, is getting 20. And so we'll be working with CSC as well. But there's quite a bit of money out there, and we want to make sure that we are participating in those funds and with our partners and so on and so forth. We've also had an approach with a private donor that I will be writing up a proposal for another 50,000. And in theory, if things go well with that particular donor, there may be more funds in the future, but it's kind of a test and see. And then
Measure 110 grant is reoccurring.
the good news, yeah, as Shirley was telling me, the Measure 110 grant is a reoccurring grant. I'm not sure what amount of funds we're going for with that. It depends on what we kind of want to do, an environmental scan and understand what all the agencies in our area are going for. We know that the major ones like Chance and CSC, there may be some others, and the more we can work together in a partnership, the more likely we will be able to acquire more funds, and the likelihood of success is greater. I know for our facility, in talking with some of the other facilities, I'm shooting for about $1 million, and we'll see what happens with that. It may be less, but some of the components is a little bit different tenant. As was mentioned a little bit earlier with mental health. So as part of the grant and the write-up, I am going to be requesting mental health specialists. We're doing outreach. We're going to probably explore transitional housing. Certainly the shelter and so on and so forth. So we'll be working with the grant writers and assessing where's our best kind of niche, and where are we best suited for the activities and such, and what's best and what's most needed in East Lynn County, Sweet Home, and Lebanon area. So we're kind of hitting a few areas, but our emphasis is certainly the sleep center coming up. That's about all I have at this point, and certainly open to any questions or anything like that.
Questions, anybody? Did the county say when they were talking about possible tax lot size, what size? Do we know at all what they were referring to? I don't know what the tax lot of the property we're looking at, how that's broken up. And I'm going to
I
assume
believe we get to define it based on what is provided to them. And I think, at least my understanding from last meeting, where we kind of left it was at 2 acres.
okay, because I wasn't sure if that brought it down to 1 or if that was 5 or what that looked like. And so
At least in my conversation with Will, my impression is it's based on what we submit to them.
okay.
They just need to form it into a lot, and it's basically changing the naming schema of it and such. And I'm way outside of my league, and this is probably best with Blair or Ray to answer these questions. But my impression is we get to define it. We just need to tell them what we need.
Okay. Blair, do you have anything to add on that?
Yeah, so right now it's all one tax lot. The county is essentially saying that they wouldn't want to give us an easement. They would want to transfer a portion of it, but they want to keep part of it. So that requires splitting it. A partition is, in this case, is fairly easy to do. It's not really that time consuming. We could do it in, if they were all ready, we could do it in a couple weeks. Usually the thing that takes the longest is making sure the survey is all done and ready to be recorded. So I was unfortunately, I was out of the office today, recovering from a cold that, so I was not a part of the phone call that Brock was that he mentioned. The delay, something that would take a couple months into 2022. Is that what I understood, Brock?
Yeah, my impression is that based on their recommendation from the lawyer, and how it's defined, they may have to go through public comment and things like that. So there's some administrative delays. It wasn't necessarily our delays and such. And I think there may be some opportunities to do some pre-work and things like that. And even regardless, just to get it graded and get the sewer water dynamic, and it's going to take time. So the more we can at least provide the quote temporary space, start construction on the huts and such. Then we just, at some point when we're ready, we start picking them up and delivering them and designing the space and doing it, kind of right. In the meantime, I've been working with the heating specialists and the event tents dynamic.
So I can't speak to exactly what would take that long on the county's end. That sounds like their administrative rules that they would have to follow. But the actual splitting of the lot is not it doesn't take that long. It could be done. What I think is more likely that we would hope, I would hope at least, is to work out a temporary lease with the county to start occupying the property as soon as possible so that we could get work done on it. Because even with the public works site, we're talking a fair amount of work being done for something that's only going to be used for 2 months. And that's a concern when it comes to the public's resources. I would hate to go forward and put down a bunch of rock and grade parts of the public works yard and put up fencing, only to uproot and then move over just a little ways away. So we're going to keep on pushing at that at a temporary lease and see what we can get worked out. I can't imagine why they would have a problem with that unless it's an insurance question, some sort of liability issue, and we can probably mitigate that, but we'll have to just see if the county's willing.
That sounds perfect. Yeah, I got the impression, at least from your end and their end, it's like by the end of the week, and some of the other administrative stuff is what would take time. And I don't understand that dynamic, but we're moving forward and at least planning from our end what we can do, from, when we're given the go.
One more thing on the site, we do have Joe and I have been plugged in enough to go back and forth with Joe on a site plan so that we then shared with the county, showing exactly how much space would be left for them and how much we would use with our site. And the current size on that site plan is 1.9 acres.
Okay.
It's a very easy fit. The Walla Walla site, I think, is actually just about an acre. I think Joe estimated an acre and a quarter to an acre and a half, but it's more closer to 1 acre than it is to an acre and a quarter. So I really have no doubt that it'll be big enough. And we also kind of worked out the county's use for it with the dump and fill station for RVs. And there's plenty of room for even the worst RV driver to be able to navigate a loop and on that side of the property. So I'm really pretty confident that there's not really much to complain about with that plan that we've put together. And so we'll just keep on pushing that forward. That's what they were waiting for, and they have that now. So it's really on their end, I guess, when it comes to how long it takes.
Yeah, I think you guys are awesome at defining that. And I believe the actual footprint is right at an acre, or 0.93 acre. It's like 100 by 300 foot for that. But when you include the parking around and then that outbuilding that's kind of outside of the fence, I would agree it's about 1.25. And so we should be plenty fine with the plan that you guys put together.
Any questions on that plan that's in front of you? Brandon just told me that he's got it on the screen there. I can answer any questions about that if you'd like.
So Bob, go ahead.
This is Bob Dalton, and my question is, with this project, my understanding a little bit, and maybe you can fill me in on this, but the discussion with the county, my understanding was, what are you asking for in size of property? Are you asking for 1 acre, 2 acres, 3 acres, or 4 acres? And to me, if I look at a development that is going to incorporate Conestogas, and somewhere in the future, we see a development of tiny homes that could support another phase or level in this transition, why would we ask for 3 acres and let them settle on 2 acres?
Why did you say why wouldn't we ask for 3 acres?
Why wouldn't we ask for the moon? Because I mean, I've been involved in a lot of projects in my past, and believe me, you ask big and settle for less, and less may be already double of what you originally needed. So why would we just limit ourselves to 0.9 acres or what that be versus 2 acres?
Yeah, so I get the point, and I'm all for asking for the moon, because I'd like the moon. But in this particular circumstance, the county's use for the property is also something that is a city interest as well. Having that RV dump and bulk fill station is a desirable amenity to have in town. But also, it's something that helps pay for the extension of utilities to the site. And so we do want to make sure that site still happens and that we can accommodate that site. And I believe we can in this scenario. I hesitate to go much smaller for that site, because when you're dealing with RVs and trailers, enough of a turnaround is always desirable, and even more than what you think you're going to need for a turnaround is desirable. So if it weren't for that, I would be asking for the whole property. But that's an amenity that I think we really want to see happen as well.
And my point being is, with this so much effort being put into this, I would hate to see us put constraints on ourselves and thinking we've got it good now, but 5 years down the road, we're going to be looking for a different location because this one isn't big enough to develop it into the phase
I
2 or
think
3.
It's almost 2 acres that they've got mapped out there.
Yeah. See, I see the 1.9, but
Yeah,
Yeah, it's actually, we had asked for 2, so it gave us plenty of room for parking and movement around it as we move forward. But so the original conversation that I had thought was happening with the dump site was that they were going to be able to pull out there at Bimart instead of looping around. They were going to be able to flow through. Has that changed?
Yeah, unfortunately, that was a hope, and we had
Okay.
contacted the owner of the Bimart property trying to push that forward. The owner of the property, to his credit, paid like $3,900 for his traffic engineer to go over it. And ultimately, based on that engineer's report, the owner of the property concluded that it was too much of a traffic impact, and he was concerned about both the effect on Bimart and the safety of routing traffic through there. Now, it's certainly arguable, and I read through the report as well, and I feel it could be mitigated, but ultimately it's his property and his choice, and he made his final decision on that to decline.
Okay.
And I know from our group, we are not at this time looking at any kind of dynamic other than what we call those temporary huts or shelters and such. And so when you get into tiny homes or transitional housing, now you're on, it's really now city planning. What do you want the use? Where do you want the use? And does it make even sense in that area or other areas? And it's outside of our scope anyway, at this point.
And I would agree that you kind of want to have a separation for them to feel like they're moving forward farther than on the same site. But is that adequate parking that is outlined there? I remember how many cars were pulled up to the facility at Walla Walla, and it seemed like there was more all across the full side. Is that going to be adequate?
So in this particular case, I don't recall. I believe there an outline of the size of the Walla Walla site on that map there.
Yes, the pink line.
So Yeah, I the Walla Walla site fits pretty comfortably in that property. And so my understanding and going over it with Joe, on the north side of the lot, and on the north side of the compound, I should say, the sleep center, whatever we're calling it, all on the whole north side and all on the whole west side, you have room for
More
people to
parking.
park, head-in parking. And I think that basically is at least as much parking as the Walla Walla site, if not more. I believe it's more. I know the county had brought up concern about screening it and wanting to have vehicles parked inside the fence. Personally, I don't think that really works very well with the model, but I think that there can be a lot done with landscaping and other things that can screen the parking quite nicely without having them inside the secure fence.
I would agree with that. Anybody else have any questions?
I do have one more.
Okay.
And it's actually a follow-up from Brock. Earlier, you mentioned all of this grant funding availability out there possibly, and you were hoping 1 million, maybe 900,000, which those are big numbers. How much of that amount would be directed towards the Sweet Home project?
Good question. So the reason I came up with about 1 million is we were at a shelter meeting with all the Benton County shelters, Lynn County shelters. And what I've found is an average shelter runs about 1.25 million to run. And that's what, the intent is to get this fully funded. But our charter for FAC really truly is outreach. Now, that number isn't anything compared to what it takes to run a shelter. And that's why we're kind of developing the budget for these grants for things like transitional housing. We may get into that space because there is not adequate transitional housing in East Lynn County. But for right now, I would say the majority. We don't take salaries. We don't. I mean, so the cost is minimal. We're looking at a minimum if we hire 2 on for the period that we need. It runs roughly about $190,000 a year just for the labor to satisfy that. There are some startup costs that we'll need to incur that we're planning for. The actual operation, at least based on my numbers, is about 300K, 329K if it's fully loaded. But again, we're getting good community support for volunteers. We'll have to play it by ear, but the goal is to work with the community there. You have some groups, what are they called? The mental health group. Well, we will be working with Shem also, but so when we provide services for the homeless, you have things like food services, you have health services, you have individual services like getting IDs and things like that. Those are minimal costs. Mental health services. And so there are groups out there in Sweet Home that we want to partner with and apportion funds for those things. So we want to fully load what it will take to do the shelter. We want to fully load what it does for mental health. Because there's, in a sense, so much money out there, we want to make sure that at least Sweet Home for this, those that are working with us and for us, we want to try to obtain funds. And so we have professional level grant writers that are provided to us by the county that we're going to ask for what makes sense for Sweet Home.
Thanks, Brock.
So do we have any built-in money for building the shelters?
Yes. So I currently have funds for the shelters. I have a donor that will likely provide me some additional funds. And then starting in January, I have a grant that begins. And so I have funds through that. And that's about 150,000 as well. So I have funds to start immediately. Also, we are in conversation with the Hope Center, who has some delays in they provide basically shelter for families, or their intent is families and women with children and women. And there are some delays because they've had a few hiccups, and we've even offered to help partner with them to get them the funds they need to hopefully accelerate their release so that we can cross coordinate and get some of that as well, so that we can, open up the Hope Center, get it operational for the transitional and emergency housing there as well. And then we're, I think, meeting with Chance here soon on what their plans are for East Lynn transitional housing and such. And we want to put a big proposal for them as well, because the services in East Lynn is, I say, quite poor. I mean, we were some months back looking at putting in a mental health home, and we weren't even getting support from Lynn County Health. And so things, I think, have transitioned, and I think we're in a position to get support, and we have some opportunities with funding to get the right level of support for this area.
So, Dick, were you able to deal with the sound? Okay.
Oh, darn.
All right. All right. Well, okay. Okay. I know sometimes if people sign off and come back on, that those kind of things are worked
I
out.
think he did that. I signed.
Oh, okay.
Yeah.
Sorry. Well, I didn't know if you had something in the chat or not. Any other questions? We're moving forward slowly, but moving forward. All right. So to be continued, I guess. Originally, we had talked about the first part of December to getting something up and going at the Public Works. And so one way or the other, I hope that we're able to meet those hard weather deadlines, because we've got people that are going to be wet and cold if we don't. So moving on, the next item on the agenda is Mayor Pro Tem. Councilor Gerson has someone to introduce to us. You can do whatever you want.
Okay, so the Youth Advisory Council is operating, I hope, and we have a representative here from the Youth Advisory Council who has been appointed as an ad hoc member to your committee. It is her choice. So her name is Bee Reeves. She is a freshman at the high school. She spent, I don't know how many weeks in the youth leadership training program this last spring. So she has a very good idea of leadership skills. And the goal of the Youth Advisory Committee is to have youth have a voice, even though they know they don't have a vote. So I hope you welcome Bee and her mom, who has to chaperone, of course, because she doesn't drive. So, and I appreciate Anne-Marie really very much. So anyway, I wanted to introduce Bee to you, and I think you'll find her a very interesting young person. So thank you.
Thank you. Thank you very much. So are the YIC meeting monthly now?
I'm sorry?
Is the YIC meeting monthly now? Do we
The
know?
YIC will be meeting this Wednesday.
Okay.
Right. So
Bye.
we meet once a month.
So if there's anything that you would like to report on what's going on with the YIC, with the leadership kids, with the high school, that has to do with well-being within the community, not just physical health, but emotional health, all aspects of being a healthy community, you would be welcome to do that. Because at the end, we're going to go around and everybody in this room can report on something that we may not have talked about yet, clarification, something they want us to be aware of. It's a good of the order time. Okay. And then if you want on the regular agenda for a subcommittee report, then we would put you there too. Okay. All right. Thank you. And I'm glad you're here.
The president of Rotary is right over here, and normally we ask young people to come to our meetings, and we even buy them lunch.
We would love that at something Tuesday. We'll reach out to
That would be nice. Okay. Anything else? Okay. So welcome aboard. And we are kind of light tonight. Normally there's a few more people here. Okay. And we have people that kind of come in and out as they're involved with different activities. So let's do a go to the order and go around the room. Mr. Nish.
I don't have anything.
Thank you.
Just a few things that are going on. We're starting our painting of windows. So if anybody doesn't know about that, we're painting windows and we're looking for volunteers. Anybody that wants to do that, youth, whatever, let us know. I can give you a phone number. Diane will be able to give you our phone number, get a hold of us. We also have the Christmas cards, which we've cleaned, repainted. We painted extra ones. We're getting ready to put those out. We have new lights to go up for them this year, and we have some other decorations that we're going to put around some of the businesses and stuff in the town to try and spruce up our city. So,
Okay. Mr. Morgan.
So Chief and I, is this working? Chief and I met with Family Tree Relief Nursery in Albany last week, and we were discussing Measure 110 and the lack of response to it. There's not as many citations throughout the year for possession charges, so we're not seeing folks go to as many people go to court or try to avoid it through the phone call they got to make. Very, very few phone calls coming into the centers. Family Tree got some money to run Measure 110, a 110 program, and they're looking for ways to get folks connected to it with fewer citations going through it. So they went. Basically, we talked about it, and they're going to be coming up here and doing some outreach, beginning this Thursday. 2 representatives from them will be coming up here trying to connect folks to their addiction services. So kind of an exciting little thing here. I'll be going out with them and talking with folks who can use that service.
Would they like to come and give a report and tell us about their program?
I'm sure we could talk them into doing that.
Okay.
I bet they would love to do that.
Just let Julie know when that arrangement has been made and they can be put on the agenda, okay?
Okay.
Thank you. All right. Oh. And Ben? Okay. Anything new going on in the community that's healthy, wealthy, or wise?
I forget everything already. I got that right.
Okay, sure. Like I believe that. Stage fright, I think, maybe. Okay. Counselor Gerson, do you have anything you want to share? Thank you. None? Holy cats. I think this is the quietest you've been.
whoa, we
That
had
is
somebody on.
quiet.
So
Wait.
I think Dick was finally able to get all dialed into the meeting, so that it might actually be. to this way.
Dick, would you like to?
Is my audio working?
Yes. Woohoo.
Yeah, well, I'll yell at Brandon another time. I need to swing all the way back to the beginning because my name doesn't show up in the minutes.
Oh,
So if you could figure out how to add me to the minutes.
yes, we will.
Otherwise, Bob did a great job. Thank you very much.
Okay, perfect. You're on them. All right, Mr. Dalton.
I think I've used up my time for most 3 meetings probably, but no, not at this time. I think it was a great meeting. It's good to have youth advisory here as well. So welcome.
Okay. Thank you. And with that, yes. Oh, Shirley does. Woohoo, Shirley. You got
Oh,
the,
sorry, it's Brock again.
Oh,
But
no.
just quickly, we did have our first case of COVID with the homeless. Unfortunately, we didn't find out for quite some time, but that individual was sent to Coos Bay. I did hear that they are doing better. And as part of that, we are following strict COVID protocols, and we were able to obtain rapid COVID tests from the county. So I guess we are saving them somewhat for the shelter, but if there's individuals that I know working with Sean and others, if there's a definite need, we can conduct some of that. That's all I had.
great, great. Thank you very much. Shirley, did you have anything you wanted to add?
Not at this time, thank you.
Okay. And Blair, did you have anything you wanted to add?
Twitter is like to dinner.
Oh.
But he said he didn't have anything else to add.
Fine. All right. So with that, and seeing no further business before us, the meeting is adjourned.
Thanks, everyone. Happy Thanksgiving.
You too. Are you staying home?
Yeah. Hiding under the covers.
Yeah, we've got 19. Trying to figure out how to get 19 into my house.
It's called moving out.
Yeah. Yeah.
Take care of yourself.
Let's see ya.